Hello friends, today we're going to talk about hair transplant. What is it? What are the sites it's done? Why it's done? And what are the different methods of this procedure? Now let's talk about what is hair transplant. Hair transplant procedure done by taking hair from abundant hair site of the patient's body and transplant them to the site where the patient have less to no hair, usually at scalp or beard. The first transplant method is called FUT, that is follicular unit transplant. In this method, by taking skin strip with hair and extracted hair follicles, these follicles then plant to the site where patient needed more hair on their body part. By this method, more hair follicles can be extracted and it's cost-effective way for hair transplant, but there is a risk of scar formation at donor area which delay the recovery. The next method comes in list. It's called FUE, that is follicular unit extraction. In this method, by the help of punch tool, each hair with its follicle can be extracted carefully and implant to the receiver site. Small area used for extraction every time, so in result patient get a very tiny scar. Because it's a lengthy process, so it is more expensive. The another method of hair transplant is called robotic transplant. In this method, hair transplant from donor to receiver site is done by robot and artificial intelligence. Lastly, we will talk about body hair transplant. By the help of FUE method, if patient have large amount of hair on their body part, it can be transplant to the body part such as beard or scalp where the patient require more hair growth. In this method, number of hair and chances of success increase, but due to the different growth cycle and hair texture on different body parts, the recipient hair can grow unnatural hair. If you think this video is helpful, please like and share. Thank you.